From the Income Protection Journal, you're listening to the Income Protection Journal podcast with Jamie Fleischner.
For dentists, income risk is very real. Clinical work is physical, precise, and closely tied to the health of the practitioner. When illness or injury interferes with the ability to practice, even temporarily, the impact can extend beyond income to patients, staff, and the stability of a practice. Today's episode looks at disability insurance for dentists through lived experience. My guest is Dr. Eric DeHunt, a longtime dental practice partner, educator, and clinician and client. With decades in practice and leadership roles in dentistry, he brings a grounded perspective on what it means to protect income with your hands, health, and focus are central to your livelihood. Dr. DeHunt is a partner at Greenwood Dental Associates here in the Denver metro area, specializing in comprehensive, restorative, and aesthetic dentistry. He has been named a 5280 top dentist every year from 2009 till current. Dr. DeHunt trained at the University of Michigan and completed a general practice residency at the University of Colorado. He's also serves as an adjunct faculty at the University of Michigan School of Dentistry and sits on the board of the Dentist Professional Liability Trust. He has a special interest in oral cancer and has lectured nationally on its dental management. This isn't a technical discussion. It's a real conversation about risk, responsibility, and what dentists often don't think about until their ability to practice is interrupted. Dr. DeHunt, welcome. Thanks for being here.
Yeah, thank you.
Yeah, thanks for being here. So to start out, maybe tell us a little bit about your role in your practice, like what a typical work week looks like.
My typical work week is a 4-day, mainly clinically based dental practitioner. I do have an administrative day once a week, but my typical clinical days are 8-hour days where I'm treating patients and chairside. So it's heavy clinically based and, some practice management stuff on the days off.
Okay. So dentistry is really hands-on and it's pretty physically demanding. I know we've talked about this over the years. At what point in your career did you first realize that your ability to practice is tied to your health?
Well, when you're 20-something years old and in dental school, you never would think my body could give out by doing dentistry. But dentistry is really physically demanding. And I guess somewhere in my early 30s with some neck issues and some back issues, I started to realize, this profession could take a toll on your body. And as you age, that only multiplies with time. So yeah, it didn't take long, 10 years. And I started realizing that my physical health is really important to my ability to practice.
Yeah. And is that pretty typical among your peers? Like, do they start to feel it? Have you seen it with a lot of them?
Yeah. I mean, I think all of, it's a common topic in dentistry that's really not talked about in dental education. It probably is talked about more now than it was certainly when I was in school. But, yeah, I mean, I don't think I'm, I think I'm the norm. I mean, I think all sorts of physical issues can occur as a result of doing dentistry every day.
So you work with a lot of dental students. Is
Correct.
This something now that you're kind of on the other side? Do you see it in a different perspective?
Yeah, well, I do, because when you're a dental student, you're learning. And so, ergonomics and body positioning is the last thing on your mind. And you're in your 20s, and yeah, you can turn yourself upside down to work on an upper tooth and not think anything of it. But really, that's not what you want to do long term, because your body will tell you that it can't keep up. So it is something that when I'm watching young dental students treat patients, it's something that I try to remind them of, because it will come back and catch up with you.
So you're saying that they might need to sort of modify how they practice to avoid problems.
Yeah, I mean, I think some of the biggest advancements in ergonomics that have come about are, obviously magnification, lighting. Now there are ergonomic loops, which are basically 90-degree loops. So you can, when you're working, you're looking straight forward. That takes all the pressure off your neck, and the actual magnification is directed downward. So you're in a much more ergonomic position to treat a patient, and that I think is going to help these these issues, a big help for the issues that a lot of dentists face.
So what are the biggest issues that you've seen, like just yourself, your peers, and other dentists? I mean, I know back and neck is a big deal, and hands.
Back and neck is a huge deal. I've also had surgery on both of my hands, which basically came out of nowhere. I had no um, no previous injuries or problems, but I developed arthritis in both of my thumbs directly related to doing dentistry. I really, looking back on it, don't think that there was anything I could have done differently. But
Is it
yeah,
just overuse kind of injury almost?
overuse, repetitive use. Obviously, carpal tunnel syndrome is a big issue we see mainly in hygienists, which is more repetitive movements over time. But yeah, even just doing dentistry on a day-to-day basis took its toll on my hands, which was a pretty scary time.
So maybe kind of walk us through, like, how did that develop, and then were you out for very long, and how did that impact your ability to work?
Yeah, so it just started gradually coming on. Probably, I would say in my mid 40s. I'm currently 53. I noticed like holding a glass or riding my bike, those sorts of things would start to irritate my thumbs. I didn't really think anything of it. I am a big cyclist, so I do ride my bike a lot. Then I started to notice it clinically, holding hand pieces after a long day of work. My thumbs would be more sore than normal. And then it became constant where whatever I was doing, whether it be picking up a glass anytime or riding my bike, doing dentistry, holding a ski pole, I was kind of in chronic pain. And so that led me to seek some opinions from some hand surgeons. There was some x-rays done. There was severe arthritis in both of my CMC joints, which is in your thumb. I tried to manage it with multiple steroid injections, which didn't really help. And then I was on, Celebrex twice a day to try and manage the inflammation. That didn't help. And then there just became a point. I remember I was sitting in my house and I was like, where this is going to end is I'm going to drop a handpiece in somebody's mouth and my career's over. And I just decided I needed to take the time to address my physical limitations at that point. And so I had surgery in September of 22 on my right hand, which is my dominant hand. I was really nervous about having that procedure done. The doctor expected me to be out non-practicing for 3 months and then slowly getting back into practice. I asked if I could do both my hands at the same time because that would only keep me out 6 months or 3 months versus 6. He said, "You're crazy." He's like, "You need one hand to function." And so I did the right hand. And realistically, I was only out about a month. And then I was back at a probably 50% capacity for the second month, and then kind of ramped back up to full go in month 3. And my left hand,
and then you had to do the other hand, right?
Yeah. Then a year later, I did my left hand, which the symptoms were worse in my left, but I obviously wanted to get through the right first because it was a bigger deal. And the left, I honestly was out maybe 3 weeks. And I was back practicing full board just because obviously I'm not doing as much with my left hand as I am with my right hand.
So walk us through. So when that was happening, what went through your mind in terms of how am I going to manage my practice? How am I going to manage my patients? Like how did that all come about?
Yeah. So the first go around, so I have a partner, fortunately, and she was able to help me. But the first go around, I actually brought in a dentist to manage my patients because obviously she couldn't take care of all of my patients and her patients. So she came in, another dentist, and helped. And then the second time around, I really didn't do anything.
That's an expense, right? Like
it is an expense, yeah. And I had to pay her. Fortunately, Jamie had set me up with business overhead insurance, which allowed me to, it covered me in some of those expenses that the practice had during me being out. And that's a
Yeah.
pretty short window.
Because it's only a 30-day waiting period.
It's
Yeah.
only a 30-day waiting period. Yeah. So, it was really pretty quick to kick in. There really wasn't a lot of hassle with the insurance company paying. Obviously, on a personal disability situation, my personal disability did not kick in fully, but I did. I can't remember, Jamie. I did
Yeah,
have
because I think
some
we were,
benefit.
I do recall because your policy has a partial disability rider. So we were keeping track.
Yes.
Even
Yep.
if you go, so there's a 90-day waiting period, but if you can't go back full speed,
Yep.
you only need a 15% loss of income. So if there was any loss of income, they could pay that proportion of your benefit as you're ramping back up.
Yep.
Yeah.
But those are those insurance policies that you kind of pay for and you never really think that you're going to need them. But, I'm here I am, sort of 30 years into my career and I'm exercising them already, unfortunately. But no, it was helpful to have that. It was sort of peace of mind too, that, from especially the business overhead, from that perspective, I wasn't going to be putting a tax on the practice more so than with me being out. It helped kind of soften the blow a little bit for the practice itself.
Well, because as a business owner, you still have to pay staff, you still have to pay rent,
Yep.
you have to keep the lights on. I mean, you have to do all of those things. And if you're absent, at least
yeah, and I certainly with the way that things are in dentistry right now, staffing was a big issue. I mean, I did not want to say to my staff or my assistants in particular, or hygienists for that matter, hey, I'm not going to be here, so you guys, I need to cut your hours or things like that. I mean, good staff is really hard to find. My staff's been with me for a really long time. And so I was able to pay them through that time where I was out of the office.
Yeah. So at what point when you were early in your career, did you look at things from a business perspective versus just an individual perspective? Because I remember early on, you got that overhead policy.
Yeah. Earlier on in probably in my early 30s, I mentioned that I had some neck and low back problems. I had numbness in my index finger on my left hand. And so I had an MRI and also have some pretty significant degeneration in my spine. And I was talking to surgeons. They were saying, hey, it's pretty likely that you're going to need a fusion at some point, which is a huge, huge surgery. And so I started to realize then that, hey, I need to be covered as much as I possibly can, just in case something like that
every
happens.
Opportunity you had, you increased it because you knew that someday. So, so I think sort of the rule was, or the lesson to be learned is when you first got that policy, get as many increase options as you can. So when you first got that policy, you had none of these issues. And so when you went to increase, the only thing they asked was financial. They didn't even need to know any of that. And so you were able to really take advantage of that.
Yeah. I mean, fortunately, I met Jamie during my residency at the University of Colorado. And so I was set up my personal disability right out of residency. So I was, 24 years old or whatever. And then the business overhead, I started a little bit later, probably in my mid 30s, where I was, Jamie and I had talked in my partner as well, that, this is a good idea. Especially being in a partnership, should you need to go out, we can, have some protection. So that really helped. Yep.
So do you think that the risk is different for dentists than other professions? Are there any unique risks?
Yeah, I mean, I do. I mean, I think neck and back is a huge issue for dentists in particular. Just working in the way we work is really tough. I mean, my hand issues, my orthopedic hand surgeon referred to it as surgeon's thumbs. I guess a lot of surgeons also deal with this particular thumb issue. So, I mean, I think dentistry is very demanding on your body. how it compares to other professions, I don't know, but I do know that dentistry is hard.
I think, and what's interesting too is you're such an active person. Like you're really healthy, active. You ski, you bike, you do all of those types of things. And if you didn't do all of those things, you wonder if you'd be in more trouble. I don't know.
Yeah. I mean, one of the things that these little wake up calls has done for me is stress the importance of that. Staying fit, and probably the last year or so, which I was never very, very good at. I started, weight training, and that definitely has helped me sort of minimize the aches and pains related to daily work life. And I will continue that moving forward, because if I don't do that, I'm worried that, that's going to cut my career short.
And are you planning to work all the way till age 65 if you can?
I am planning to work 10 more years. I just signed a 10-year lease for our building. So that's kind of a good endpoint, or not endpoint, but kind of that finish line-ish, and then kind of taper off and slow down.
And remind me, did you buy an existing practice or did you start from scratch?
So no, I bought into a existing practice. It was a 3-doctor practice. That partnership dissolved, and I became an associate in 1999, and then became a partner in 2001. And then my previous partner retired in 2015. I had first right of refusal to buy the whole practice, his half. And I just didn't want to take on that responsibility. I'm just by myself. So I have a new partner. We've been partners for 10 years. So and she's a little younger than I am. So hopefully we can get there. And
you'll create a succession plan, however you see fit.
Yep. And that's probably coming in the next five years or so.
Yeah. So there's a lot for you to think about other than just dentistry. It's a lot. It's a lot.
Yeah, and dentistry is changing a lot too in regards to private equity and corporate acquisition. And it is really my goal and my partner's goal to stay independent and be able to keep our practice, privately owned.
Yeah. Do you get approached all the time by private equity?
All the time. All the time.
It feels that way. And it seems like a lot of practices are going that way, that direction. And veterinary practices and dental practices, and they all kind of feel the same. Like it doesn't have the personal touch anymore.
Yep. And I think that, we're not a huge practice. We try to be, more customer service, more family oriented practice. And so I do think you lose a lot of that if you go to the corporate model. Also, at this point, I'm realistic that, I probably wouldn't be a good employee after working for myself for 30 years.
I get approached all the time, and I'm like, I would not do well working for someone else after I've been doing my own thing. Yeah, I wouldn't I wouldn't take direction well, because I'm just used to doing it my way. So exactly. So all right, we're going to take a break, and when we come back, we'll talk about what dentists often misunderstand about disability insurance and what surprised Dr. DeHunt once he looked more closely at income protection. We're back. We're here with Dr. DeHunt, and we're talking about disability insurance for dentists. So once you dug into the disability insurance more deeply, was there anything that surprised you about how it actually worked? So you had to actually file a claim. Was there anything surprising in that process?
Not really. It's a lot of paperwork, and you just have to cross your T's and dot your I's. They want proof,
a lot of financial documents,
a lot of financial, a lot of medical documents. I have 2 separate disability policies. I have a Guardian policy and a Principal policy. I would say that Guardian was a little easier to work with than Principal, but neither one of them were really difficult. I don't know. My business overhead, I think, is also through Guardian, maybe.
I think so. Yeah.
Yeah. And so, no, the claims adjusters were really pretty friendly and helpful, and it wasn't, I had a lot of free time on my hands, so I could dedicate the time to but
you've got a lot of other things on your mind. The last thing you want to do is be piled on paperwork. You're focused on your health and your surgery and everything else. So you don't want to deal with that.
That's true.
So So dentists often hear the terms like own occupation. Did that kind of come into play for you at all?
It didn't, but it certainly, crossed my mind. When I met with my surgeon originally before my first hand surgery, I mean, one of the questions he asked me is, do you want to continue to practice? And because based on my x-rays and my symptoms, he felt like this could be a permanent disability.
Oh, wow.
And so
That's got to be terrifying for a dentist.
yeah, I mean, my answer to the question was yes, but that certainly, made me think about, well, if this is it and I can't practice dentistry anymore, what would I do?
And you you do teach. So,
right.
So in your case, if something did happen and you couldn't go back with your hands, you could full-time teach, assuming that you're teaching without using your hands. You're doing more classroom clinical stuff.
Right,
so,
right.
And that income wouldn't offset your benefit.
Correct. And it was nice to know that, that I had that own occupation rider in my policy, and that, so, if I couldn't practice dentistry and wanted to do something totally different, I still would be covered.
Yeah. So if you were speaking to younger dentists, like, you're around a lot of these dental students, what advice would you give them?
Well, first and foremost, I would say take care of your body, because it is really important, and it is it is how you earn your income. Second, I would say protect your income by getting the right insurance, so that if something does happen, you have sort of a backup. Yeah, I mean, those are the main things that I would say. It's not, again, I remember being 25 years old and people talking about ergonomics. I'm like, ergonomics? What are you talking about? Dentistry is like going to hurt me. And but
I'm fit. I can do. Yeah, you feel invincible when you're younger, and all of these things just don't ever. It's all hypothetical, and I think one of the best things you did was not just get a policy, but like we said, those increase options were so beneficial to you, because your biggest risk was your change in health. So you're healthy,
correct,
and in your mind you're really healthy. You're really active, but all it takes is just a diagnosis of the arthritis or wrist or anything, and they're going to exclude that. So you've got to get all of it before that happens. Yeah,
it would have been really difficult had I not been insured as a young person, and then sort of, I would have, my thumbs would have been excluded, my back and neck would have been excluded. So, it was really beneficial to have those policies early on in my career.
Yeah. Well, I'm glad that was beneficial. I'm glad that it was relatively, painless and you weren't out too long, but it did pay when it was supposed to. So I really appreciate you coming on, sharing your story and your perspective. So thank you.
Well, I appreciate you having me prepared and prepared from the beginning, so that it's nice to know that should something go wrong, I'm covered. So thank you.
Yeah, you're welcome. Thanks, Eric.
All right. Have a good day.
All right. Take care.
From the Income Protection Journal, you've been listening to the Income Protection Journal podcast with Jamie Fleischner.